Over the past 50 years, the diagnosis of those with autism has risen substantially. Moving into the 21st century, researchers note that 1 in every 68 individuals are on the autism spectrum, and that statistic is still rising today. While this research is uncovering valuable information surrounding the autistic community, those individuals are not receiving any benefits from this. This is because society has not recognized the significant growth within the community. More specifically, post-secondary institutions have not acknowledged this increase and therefore have not created accommodations for individuals with autism. Within the next 5 years, 200,000 students with autism will be either graduating or aging out of their high school programs with nowhere to go or to turn for post-secondary education. This is due to the lack of inclusion and transition programs offered at these institutions. The number of students either graduating or aging out is a result of a 23% increase of students that have been diagnosed, as reported by a 2012 study conducted by the Center of Disease Control. These students are full of potential that is untapped, once again, due to the rarity of someone with autism spectrum disorder earning a college degree. In order to give these individuals the best chance to succeed in life, college campuses can create transition programs to allow these students to earn their degree and be as integrated on campus as possible. The students that want to obtain these degrees are usually high functioning and have an IQ of 70 or above. One must note that anyone with an IQ of 50 or above can be educable to some degree, and that the average IQ is anywhere from 70 to 130. So a question one might ask is, if students with autism have an average IQ and are highly functioning, why do they need a program? Well, this is because these students have trouble with executive functioning and social integration. These students are not able to create meaningful relationships and integrate themselves as easily as someone without autism can. They struggle with the social aspect of the campus and ultimately fail out due to the lack of social exposure and friendships. This problem can be solved with a transition program that focuses on 3 main areas. The first part of the transition program would be the location. Community colleges and smaller campuses might be much more beneficial to someone who has autism. It may be beneficial for many ways. For example, a student with autism who attends a community college does not have to worry about living accommodations or meal plans. If these students commute, they can focus solely on earning a degree, which is the most important aspect of college. These students will still be included into the social aspect of the college, granted that the special education majors fulfill the required mentorships with the student. This mentorship would be established between a first-year student with autism and an upperclassman who is working towards earning their degree in special education. In order to graduate, these special education majors will have to meet the expectations outlined by the transition program established at that specific post-secondary institution. These expectations would include weekly meetings with the mentee to go over schoolwork, student involvement, and what the student must get done for that week. The mentor would also be responsible for the student's involvement on campus of clubs and other organizations. This would benefit both the student and the mentor. The student will be organized in making friendships, and the mentor will be receiving experience in the field for future employers. The last area the program will focus on is campus normalization. This would be important to not just the student but the campus and overall benefit both communities. When a campus creates an inclusive environment and begins to decrease stigmas, the community will overall be a happier and safer place. More people will attend the campus on the grounds that the students are extremely welcome and the staff are very well versed in the falsities of stigmas produced over the years. Furthermore, inclusivity training can be given to both the students and staff to ensure that the autistic community will be treated just like any other community on campus. The training will focus on increasing knowledge of the disorder and decreasing stigmas. When done properly, there would be an immediate decrease in stigma thanks to the basic information provided through the training. Students with autism are ready to join post-secondary institutions, and with the help of these transition programs, that dream can become a reality. Colleges should be focusing on getting these students into the classroom so that one day they can feel a sense of purpose and a thriving career. Let's get these students from the classroom to career and end the stigma around the autistic community. Thank you.